Good day, everyone. I am Dr. Lesel Ganancial, and I am tasked to share with you the low carb for our workers. So I am a occupational health physician here in the Philippines. I am also a low carb practitioner for almost 5 years. So for our outline, we will discuss these few topics. So we will have a topic about occupational disease, the nutrition in the working population, benefits, and so on. So for definition of occupational diseases, according to the protocol to the Occupational Safety and Health Convention, occupational disease actually covers any disease contracted as a result of an exposure to risk factors arising from our work activity. It also defines occupational diseases in the following terms. Each member should, or under prescribed conditions, regard diseases known to arise out of the exposure to substances and dangerous conditions in the process. Trades or occupations as occupational disease. According to the World Health Organization and ILO, or International Labor Organization, last 2021, in 2016, 1.9 million people died of work-related diseases and injuries. And 81% of this died on non-communicable diseases. And these are actually the chronic obstructive pulmonary disease. It is a respiratory disease, stroke, and ischemic heart disease. According to Dr. Tedros, our WHO Director General, he was shocked to see that so many people actually literally died being killed or by their jobs. So in addition, work-related diseases and injuries can actually strain the health system, can reduce the productivity of the workers, can have actually the catastrophic impact on their household income. And the deaths from heart diseases and stroke associated with exposure to, take note, guys, long working hours rose by 41% and 19% respectively. And this is due to the increasing trend in this relatively new and psychosocial occupational risk factors. So this is a busy slide, but this is the list of occupational diseases according to the International Labor Organization. So we have different kinds of occupational diseases which can be caused by exposure to agents arising from work activities. And these are the chemical agents, exposure to physical agents, and exposure to biological agents, infectious or parasitic diseases. Another one is the occupational diseases by the target organ systems. And these are the diseases arises from respiratory disease, skin, musculoskeletal disorders, mental and behavioral disorders. And guys, take note, we have also occupational cancers. And these cancers actually are caused by exposure to following agents that are presented in my slide. So now let's go and let's have a small discussion about nutrition in working population. Nutrition actually plays a crucial role in maintaining our energy levels and productivity at work, right? Do you believe in that? We all know that food and beverages actually that we consume directly impact our physical and mental well-being. It influences actually our ability to concentrate, make decisions, and this is the best to sustain high levels of productivity in work. Actually, there are several ways in which nutrition is relevant to maintaining a high energy and being productive in the workplace. You should have a stable blood sugar, you should have a stable brain function, a proper hydration, a proper fasting. You should prepare a nutrient-rich foods. You should also manage or take note of your weight. And you should always know how to manage the moods and the stresses that are happening in your environment during work. And the very important is the employee's well-being as a whole. So in low-carb diet, we have actually a safe list, a caution list, and a danger list. And this list actually is from my dear Doc Gracie, our diet doctora in the Philippines. And if you're thinking, what are the primary principles in low-carb diet? So in low-carb diet, we reduce the carbohydrate intake, we remove the high carbs, we all reduce these sugars and starches, we increase our protein intake. So these are the foods that are rich in protein intake. We eat healthy fats here, and these are the sources of healthy fats. And we really emphasize the whole foods, the real foods that we should eat. So unprocessed, these are unprocessed foods, and veggies also are highly encouraged that are low carb. So don't worry, we have actually the list of the foods that we can prepare in our table every day. But don't worry, we can also eat fruits. So the very examples of fruits here are the berries. And we will always focus and study what are the nutrient-dense foods. Because when you focus on a nutrient density, nutrient-dense foods actually provides the essential vitamins, minerals, and nutrients. And this is actually the very, very important thing that we should always remember, that in a low-carb diet or in a lifestyle in low-carb, we will always focus on individualization, because there is a no one size fits all approach. So what protocol we gave to patient A, it's not same with patient B. So we really study the history, we really do a proper channeling of all the problems, all the goals of the patients before we teach or we do the proper low carb diet or lifestyle. So always seek consult to your dear doctors and your dear coaches. So what are the benefits of low carb diet for workers? So when you are in a low carb state, in a low carb lifestyle, there will always a stabilization of blood sugar levels. So when you maintain a blood sugar level, which is very, very normal, you could have a consistent energy levels throughout the day, and productivity is very, very high. In low carb diet, we enhance the fat utilization. So when your body shifts the primary fuel from carbohydrates to fats, actually it can help you to have a prolonged physical and mental activities. You can do your works or your tasks as soon as possible, because we all know that fats provides a sustained and steady source of energy, which actually, yes, it promotes endurance and it reduces the need of frequent refueling or re-snacking. In low carb, we reduce insulin resistance. And that's really true, because low carb diet improves insulin sensitivity. We all know that insulin is a hormone that helps regulate blood sugar levels. And a reduced insulin resistance means that your body actually can more effectively respond to insulin, which could lead to a better control of your sugar and improve your energy utilization. Actually, this can be particularly beneficial for workers who experience insulin resistance due to a very sedentary behaviors or high carb diet. When we say sedentary, these are workers or employers that are not moving in their chairs. They're all working from home. This is all sedentary lifestyle or sedentary works. So another one low carb benefit is the appetite regulation. So actually, individuals in a low carb diet or workers in a low carb diet, they feel more satisfied with their meals, especially if their meals are nutrient dense foods. And they are actually less prone to frequent snacking due to high fuel, especially the fats. And this is actually a great advantage for workers who really need to concentrate to finish their task today without any distractions of hunger. So another benefit, or the last benefit of low carb for workers, is the weight management. Why? Because if you are on a normal weight, you could have very, very good energy levels. You don't feel tired. You don't feel sleepy. So if your energy levels are very, very high, it leads to increased productivity. But remember that individual responses to diet can vary. So the appropriateness of a low-carb diet, actually, it really depends on our health status. If you have comorbids, if you have medications taking, if you have diagnostics that need to address first. Yeah, and also it depends on the activity level and a specific job requirements. So you should always seek for a healthcare professionals or coaches to ensure that your LC diet actually aligns with your health goals and requirements. So these are just practical tips for living a low-carb diet. So you should know how to prepare your meals. So we have different pages, we have different communities who shares their low-carb meals every day. We have also coaches who really publish a book for this, a PDF for this. So try to communicate and always listen to our low-carb communities. So you can have smart snack choices for your office. You can navigate social situations and work events, and always stay hydrated and incorporate low-carb beverages. So with overcoming challenges, actually, you should actually know how to deal with cravings and temptations. You should address concerns about social aspects of eating, and you should always find balance and flexibility in low-carb lifestyle. The very, very important key here in low-carb lifestyle or changing of diet actually is discipline. And you always know your goal, always know your why you are doing that lifestyle. In addition, physical activity and low-carb living is a perfect combination. So low-carb diet plus exercise is very, very important, especially for those workers that are sedentary. So after work, you can do exercise if you want. So the best types of exercise for energy and weight management is very, very important. And we have also coaches for that. We have coaches for muscle building. So you can keep in touch with them on what exercise you will do. And it really depends on the kind of work you have. So just a rundown, actually, we have 7 common occupational diseases. These are dermatitis, respiratory illnesses, musculoskeletal disorders, hearing loss, cancer, stress, and mental health disorders, and infectious diseases. And this information is based on CDC, CCOHS, NIOSH, and ILO, and the European Agency for Safety and Health at Work. Now let's focus more, actually. One of the very, very common is the work-related musculoskeletal disorders. So according to CDC, the musculoskeletal disorders, or what we call MSD, these are injuries actually, or disorders of our muscles, nerves, tendons, joints, cartilage, and spinal disc, or our back. So work-related MSDs are conditions in which the work environment and the performance of your work contribute significantly to your condition. Or the condition is made worse or persists longer due to work conditions. Example of this one, the routine lifting of heavy objects, daily exposure to whole body vibration, routine overhead work, work with neck in chronic flexion position. And this is most common in the sitting position jobs, performing a repetitive forceful task. So we topic about pain because common signs and symptoms of MSD is pain. So what is pain? Actually, pain is an unpleasant sensory and emotional experience associated with actual or a potential tissue damage or described in terms of such damage. So there are two types of pain, and these are acute pain and chronic pain. Acute pain is a normal physiologic response to injury, disease, or surgery, and it is usually temporarily self-limited, and it's less than 3 months. How about chronic pain? Chronic pain is usually defined as a pain lasting for more than 3 months, and it is an ongoing disease or tissue injury that can persist after a resolution of or in the absence of injury. In chronic pain, there could have neuroplastic changes in our central and peripheral nervous system. And a chronic pain can be also described as a disease state. So with chronic pain and low carb, we all know that in chronic pain, there is increased sensitivity within the nervous system and an inflammatory profiles or markers. So one research actually, they have recently reported a relevant preclinical research which identified 170 animal model studies. They used the ketogenic diet to produce changes with the nervous system. And actually, these studies investigated the mechanisms reported to occur with a nutritional ketosis. So how this alter the nervous system function. And with 14 broad mechanistic themes that emerging in this includes the metabolic and energy biochemical changes, the restoration of our cortical excitability to homeostatic levels, the gene regulation was improved in nutritional ketosis, also improved mitochondrial functions and numbers. It reduced the neuroinflammation, adaptive neuroplasticity, the neurotransmitters and synaptic regulations improve. They reduce oxidative stress and the activation of the signaling pathways. So in chronic pain and low carb, there are more researchers right now that are doing, and let's follow up the researches and we will share it with you guys about the chronic pains. So always remember that if you do low carb, the chronic pain can be reduced or can reduce the inflammation. So in low carb actually decreases inflammatory markers. So if we decrease the inflammatory markers, this will actually leads to the pain relief. Yeah, the pain markers will be reduced with low carb. Also, when you are doing low carb, it can manage your weight because excessive weight can contribute to your joint pain and exacerbate the conditions like osteoarthritis. Also, low carb can reduce the blood sugar regulation or can regulate your blood sugar. So a stable blood sugar levels may help prevent complications that can contribute to nerve damage and pain. If you are familiar of diabetes have a complication of neuropathy, and neuropathy is a nerve damage. And when your nerve is damaged, you can feel numbness and there's a pain actually. So that's the beauty of low carb in managing the chronic pains. Another one, it could have also a benefits in neurological conditions. An example of the neuro conditions we have is the epilepsy. And this research, other researches, and some researches suggest that a ketogenic diet may have neuroprotective effects. And one example of the ketones that in our body is the beta hydroxybutyrate. So also an increase in omega-3 fatty acids intake, like we can see in the fishes, may modulate the neurotransmitters release and reduce the pain perceptions. Another one is the chronic pain with low carb is it improves actually our gut, our intestine. So there is a gut-brain axis which plays a role in pain modulation, and actually it alternates the gut microbiome, which influences the inflammatory responses and the pain sensitivity. And the last one is it improves our energy level. So in chronic pain conditions, it can always lead to fatigue. And we all know that having more energy may positively impact our ability to manage the pain and engage in physical activity. So thank you, and may you enjoy a pain-free and healthy retirement as we go along and as we live in this world. Thank you.